Recording started.
Hello, this is Dr. Dawn Ewing of the IABDM, and for our meeting this evening, we have a guest that is very near and dear to my heart, saves my life. This is Jessie Plunkett, and Jessie is a trigger point stretch master, and if you don't know what that is, he is going to explain how important it is not only for yourself but for your dental patients. And so we always want you to think outside of the box. It might not be a tooth that's a problem. It could be something much more than that. So I'm going to let Jessie go ahead and take it from here, and I'm going to mute myself.
All right. Thank you, Dawn. As Dawn was saying, yes, I'm Jessie Plunkett. I am the owner of Trigger Point Stretch Studio. We are a new company. I myself have background in kinesiology, personal training, and I got into doing body work with a company called Motion, and they recently just got out of the Houston market with some investor issues, I guess, but it allowed me to start my own company and do a little bit better than what they do. What we do is actually myofascial release, and I've created this little PowerPoint just to kind of give a broad approach to what myofascial release is and fascia in general, and how what pros and cons of having it and what we do to release the fascia in the body. So I'll just go ahead and start with the PowerPoint here. And we have this introduction. I wanted to break it up into two different categories. One for our dentists, the common issues that they would have just posturally from sitting in a chair, working in people's mouths, working at different angles, and very bad posture. Not the ideal way to sit all day. And then of course the clients, when they have issues, when they're whether they're having neck pains, headaches, TMJ, a lot of these common issues, and what we can do to help with that. First off, fascia. What is fascia? It's a dense web-like connective tissue that protects the muscles. It's present throughout the body, and the pros for it are that it protects the muscle and avoids injury like pulling, straining, muscle tears, anything like that. So it's good to have it, but too much of it can be a bad thing. Cons, it decreases range of motion due to restrictions, decreases circulation in order to help with the healing process, because whether you're active or anything like in the gym, you're tearing your muscles up, and if that you're not getting the nutrients to your muscles to repair them through your bloodstream, the fascia is in the way, then you can't heal as quickly or properly as you would need to. So your recovery time is longer due to the buildup of fascia. And the decrease of nerve activation in the muscles able to fire. So like if you were doing if you were seeing a chiropractor and he was saying, your glutes aren't firing correctly, it's because your fascia is so built up that your nerves aren't responding as well as they should be. And we'll keep moving on here. So we've got some common aches and pains for dentists. Would be in the pecs, so pecs minors and major. Sitting over, hunched over, and working inside a client's mouth, having your shoulders at an anterior tilt creates a very short pec muscle, and it starts to stay like that, so the fascia builds up and the pec remains that way, so it needs to be stretched out to get the shoulders back, and this can cause back pain, upper back pain, neck pain, and shoulder issues. And we would do a stretch for that to get the fascia out. And then the pec major, of course, above the pec minor. And we have the QL, which is the quadratus lumborum, and that's your low back. It's going to be a lot of issues from being bent over, very tight hip flexors from sitting all day, being bent over, and very awkward positions. And we have the glutes, the medius, the maximus, and the medialis. Or I'm sorry, minimus. I'm sorry. I'm not nervous or anything. The minimus is not the most common for pain, so I don't really have that one in here. But maximus and medius are just from sitting and not having a lot of movement in that muscle during the day, because fascia does need to slide, have the muscle sliding, the muscle fibers, and when they're stagnant, they just kind of build up fascia.
Don't talk to that. You're too nervous.
And-
Just explain it to me.
Okay. And then I have the piriformis on here as well as right there with the glutes. Same issues, just lack of movement. And then the neck muscles, this is starting to get in with the clients when they have headaches. A lot of it's the levator scapula. People are all looking at their phones during the day on their computers and just have their head down, and that muscle gets elongated. And with that comes extra pressure on the muscle that causes pain and nerve issues. And we can work on that as well. And then the trapezius as well, upper back issues. People have that, it's just stretched out from having that anterior tilt from their shoulders, tight chest muscles. So we need to kind of strengthen that and shorten those muscles up. And then we get into the neck, or the neck muscles, and towards that TMJ issues that we have. We have it's mostly the masseter that is going to be tight. And then I know TMJ is a joint dysfunction, but it comes from the masseter being very tight, and we can work on that as well.
When you say work on something, how do you release the masseter muscle?
Well, with the putting pressure on the jaw and opening up will strengthen it. And then we also put pressure on it and move with the muscle fibers as they go out.
So you're talking about releasing some of these in through the neck. And
Yes.
I know my experience with you is the release is putting pressure on a specific point.
Yes.
And
Yes.
how do you find that point?
Okay, so I have found the way to find out buildup of fascia is to palpate the area and to find very hard spots where the muscle is in contraction. And to release that, you have to have good, hard, solid, constant pressure through the muscle or in that area to release that fascia. And that will then in turn give back more blood flow, circulation will go back to the muscle, and the nerves will start firing correctly.
So I know in my experience, and you guys can't see me right now because I'm sitting next to Jesse, but I had pain that was in my left kind of scapula area going up the side of my neck. And actually the trigger point to that was in my glute on the opposite side. And so I'm sure that's, what you find in a lot of what you're looking at here.
Right.
In that it's not always the same side.
Exactly. The body is it's a kinetic chain. So I have a lot of clients that will come in with hip problems or something, but if we get to the root of the problem, which is the base, we start from the bottom up. It could be as tight Achilles, it could be plantar fasciitis causing something, anterior tibialis in the shins, or calves being tight, and then that allows the hips to work properly again. Sometimes it's just overuse because they're hindering an injury that they don't know is present, or an overworked
So they're
muscle.
compensating.
Compensating, yes.
Yeah. And so I know you're also trained in positional analysis,
Yes.
and how the person is standing and whether one ear is
Mhm.
longer than the other, which it's not
Yeah.
really, but because of the muscles being off.
Right.
ahead.
And postural assessments is what we do as well. We take a look at the person from a posterior view, the side view and everything, and we can tell just from a natural state of them being relaxed and standing. A lot of times I like to do it while I'm just talking to the client, because if you tell somebody you're going to check their posture, they try to fix it.
Right.
And so while I'm doing an intake, I will kind of assess them, and you can see the shoulders, you can see the lumbar curve of the spine, and all that. So.
You guys, this is super important, because if you're about to take an impression for, let's say, a crown, and your atlas and axis are off, and you've got one ear that's longer than another and one shoulder that's tipped down, then you're going to be taking a bite on an incorrect stance. So if you could get the stance corrected, then you take that impression and you've got a nice, good, solid bite. I didn't mean to interrupt you. Go ahead.
Oh no, you're good.
Go through here.
No, you're good. Yes. Postural is very important. And we, I don't know what I'm trying to say. Working with the clients and also doing not only the myofascial release, but doing a neuromuscular stretch where we're actively stretching the muscle, and working on flexibility. So all of what we can do is, increase the range of motion. We increase blood flow circulation. We have, the ability to correct postures with this in very quick amount of time, with how much we gain a lot of progress very fast. So I'm not sure if there's much else I have off the top of my head.
Well, I know a lot of patients that come through that have MTHFR. They have more inflammation than the average person. And so when you're going in and doing, this is not a massage, you guys. This is, there are points that are being pressed upon. Sometimes he uses a little hard ball and rubs it up whatever muscle it is while you're making that muscle move. So instead of just a massage where you're laying there, you're active participant in this.
Yeah.
Is there another slide after that?
No, that's it.
Okay. So if a patient had TMJ problems, what would you be looking at to see where the trigger point might be?
A lot of times it could be, for that one, it could be temporal, and it could be in the neck. It could be levator scapula stuff. It could be, every client is so much different. It's when I get there and I can palpate and feel with my hands where the tightness is and stuff, that's when I can pinpoint it. But normally from, somewhere in the neck or the temporal.
Okay. And what I'd like to do is see if I can, let me go check out here and tell them how you've been working on me in some places, because people sitting in a gentle chair all day long do sit in a twisted position.
Okay.
Let me see if we can turn on Zoom.
Hold on 1 second.
Now,
Okay. So while Dawn's getting the room ready, I think what she wants me to do is do a demonstration. But I have been working with Dawn for a long time now. She was at the point where she was coming to my studio with the ability just to fall out of her truck and having to lift her legs with her hands to get over the curb to get in. And at the time, her doctors were telling telling her that it was a joint problem and giving her shots for cortisone shots and stuff. So she wasn't getting the results that she wanted from it and what that she was supposed to get. But after she was done with me for an hour session, she was able to walk out to her vehicle and get in the car and got a significant amount of improvement in 1 hour session. And since then, her doctors have now started to look at her muscular structure and see if what's going on with that instead of joints. She's no longer doing the cortisone stuff, shots. She's doing treatment with me and working on the muscles that she's got on her legs and stuff. Oh, I'm sorry. Yeah, do we have any questions so far? All right.
Jesse, what I'm going to do
And
is
Dawn.
to take you off screen share
Hey, Nikki, can you take me off a screen share?
and come on out here.
Yes, will do.
Okay. And you've got yours, you can,
Come on out here. We
Okay.
should have one turned on.
Actually, no, I can't. Hold on.
or do I do it? I can stop share.
Can you stop share? Yeah, I can't. I can't do it. There we go. There we go.
See me up on the table?
Yes, we can. That's a good shot.
Okay.
We can see the whole table. So that's good.
I'm gonna have you show the difference between a massage, which this is not, and like a stretch on my leg. And it's done with your clothes on. That's the cool part.
Yeah. So what I'll do on her, we'll just do hamstrings. And what we do in our studio is we start out with the hypervolt, and this is the percussion type instrument. It will bring blood flow to the area and release that fascia a little bit for me, so it's easier for me to move it out. And it warms up the muscle, brings, that's it. Instead of having clients do a mile jog or burpees before we start, I can just do this. So I'll warm up the hamstrings.
I love that thing.
Now these things come in handy. What do you use it for?
My lower back, anything. If I have muscle pain or when I was recovering from my knee, I had a meniscus tear, a lateral meniscus tear. And because of that, I ended up with, during my recovery, like serious Charlie horses in my adductor muscles and stuff. And we had work the fascia. The fascia was just completely torqued up. So my lower back and my legs were just like all tied up.
Okay, so show where you are feeling.
So right now is what I'll do is I'll do some myofascial release with the ball here, and I'm going to have her actively manipulate the muscle while I'm doing this, to not to flex it, but just to give it some movement. And I'm going to have her breathe in, and on the exhale, she's going to move her foot up and down from the knee down. All right, so go ahead, breathe in and exhale. So I'm just putting pressure on the ball, moving it slowly, have that nice constant pressure on it. And breathe in, exhale. And move all the way up to the head of the muscle. Good. And we'll do this in 3 different zones. So breathe in and exhale. A lot of times, like for hamstrings, for instance, this is a key place for lower back pain. I have a lot of clients come in low back, And I will pretty much start here. And 90% of the time, I will find very, very tight hamstrings right in the middle from causing that low back pain. Breathe in and exhale.
And when people talk about the fascia, the way I describe it is you have a chicken bone, and then you have the meat, and then you have the skin. But if you pull the skin off, there's that clear membrane underneath, which is the fascia. And that's what has a tendency to get so tight in your MTHFR patients.
And now what I'm doing now is, after doing the fascia release, I can go through and I can palpate with my hands and actually feel that constriction of muscles. So knowing what the muscle looks like and how it's supposed to feel, very, tender, elastic. If I find anything that's just tighter in that area, that's where that trigger points are, or fascia buildup. And we put constant pressure on it, going towards the head of the muscle. And sometimes I can feel it release. Sometimes I get it to where it moves, and then the area becomes a lot more soft. So, surprised, she's actually pretty good today. Normally each hamstring takes me about 20 minutes. She must have got work done yesterday and the day before.
Okay, so what would be some stretches that they could do as a dentist? There's one that you have me sit over. You might have to go over there and already get it.
Oh.
Where I feel like I'm gonna fall off the table.
Mm-hmm. Well, this one, it's good if you have a partner to do this one.
Well, sure.
This one for the low back, for your QL, your lower back stretches. You can have do this with a partner, or you can do this sitting on the floor by yourself. I'll show you after I do this. So I call it my little teapot stretch.
It feels really good, but you think you're gonna fall off the table.
So we'll do it right first, and you'll breathe in, punch down, exhale, go to the side, keeping their elbow towards the ceiling. And I'm gonna hold this hip down. So breathe in, exhale, go over. Elbow up, good, and come forward just a little bit right there, perfect. And this is stretching all this back here. And you want to make sure you're relaxed. Muscles will, of course, they tense up as soon as they want to be stretched, or they want to fight against it. And make sure that you're relaxed, breathe, and don't rush into the stretch. You rush into it, it's just gonna be painful. So do it again, breathe in, and exhale. Good. So something like that. Also, if you're by yourself doing this one, I'm gonna jump on the table.
Yeah.
I also do a stretch class. So we do this in the stretch class. We'll have just your legs out as far as you can, and you'll put your right elbow inside your right thigh, and you'll take your left arm, and you'll try to touch your toes. See how close I get to my toes? And this stretches all this back here. So doing that, in the office, if they want to close their door and do a 5-10 minute stretch, do their
Some of the neck stretches.
Necks.
Necks are horrible for
neck
dentists.
also. Just they can do it sitting in their chair to stretch that levator scapula. Left hand over, and what you're basically trying to do is pull your head off. But putting your arm behind your body will kind of anchor that shoulder down. And as long as you keep a good posture straight up and down and pull into the side, you will get a good stretch from there. And then also same thing, looking at the opposite knee and pulling down towards it. And same thing on the other side. And down. And that's a very good stretch throughout the day, just every once in a while to do your neck, hit the back, Those are very important.
There's something laying down.
The hip flexors of the glutes.
Good understand.
Glutes is always a fun one. I like it because it hurts at first and it feels good. So this one, you have your right foot over, you do a figure 4, and you'll go through your hands and grab your left hamstring, and you'll pull towards you. And this right here stretches that right glute. So pulling this in, maybe putting your right elbow on this leg to push away, and just sit here and feel that stretch. We'll definitely stretch all your gluteus maximus, medius, and this one. Because they gotta be even or else I'll walk in circles. And the last one I'll show you for hip flexors, very tight hip flexors from sitting down. Your psoas and your iliacus, or iliac, will do, just have your foot in front of you and being able to see your toes in front of your knee. And the important part here is to squeeze your cheeks together. So squeeze your glutes, engage your glutes, and push your pelvis forward, and that will stretch this hip flexor as you go forward. But that's the trick, is the squeeze the cheeks before you move forward, and you will feel a very, very good stretch there. And then you do the same thing for the other side. So here, squeeze cheeks and pelvis forward, and just kind of lean forward into it and feel a good stretch there. All right.
And how can you see if one leg is longer than another?
Let's see that.
Yeah.
During the postural assessments, normally just key points, either the iliac crest or the knees or ankles. I can see once those things are off, you can actually see pinpoint different spots on the body that don't line up. And then you can actually see a trunk tilt from that as well, if their trunk tilts forward or if they have a twist from it as well, like a rotated trunk. That could be causing what would seem to look like shortened legs.
So you guys, if you've never taken Bob Walker's chirodontics class, that chirodontics class basically says the patient comes in and they're like this, but they walked in just fine. You adjust their bite, and when they walk out, they've got a hitch in their get along. They go to the chiropractor, they get adjusted, but then their smile's off again. So it's really important that you work with somebody that does some type of body work, so that you can, make sure that we're doing the best dentistry that we can, and that we're not pitting each other against one another. Is there anybody that had any specific questions?
Yes, first, Jamani asked about tongue tie release. She says, I have a question about tongue tie release. How do you coordinate with dentists when identifying the need for this release?
Well, Teresa, you'd have to answer that question because that's not something that Jessie does.
Okay, so basically, Jamani, we work with myofunctional therapists, not what Jessie does. And they're a specific kind of speech therapist that has additional training in myofunctional therapy. Does that answer your question?
It's going to be a different Zoom meeting.
Oh, no, she said, okay, thank you. And yes, actually, we do have myofunctional therapists who are going to be talking. We've arranged for it, right?
Yes, we
yes.
certainly have.
Yes. And then the next question is, Jessie, do you do postural therapy?
No, not postural therapy. I do postural assessments just so I know where some problems could be stemming from, in order to just assess the pain and aches that they're having.
So Teresa, I gave him Felix's first book.
Right.
And of course, a lot of the things that he's at least looking for are those things that Felix teaches about, the ears being straight,
Correct.
and
Right. And so I've been looking for somebody who can help me with my airway patients, right? Who does that kind of stuff, who can do like the postural kind of therapy and assessment and so on and so forth, because there's most of my patients don't need, once their airway opens up, man, life is different for them. But some of them are bound so tightly, you know, that I know that it's more than airway. I'm absolutely positive that they have some fairly serious fascial restrictions, but also just in their, you know, that has caused postural issues and so on and so forth. So kind of like what you do. And I'm not exactly sure what the difference is between what you do and what an Atlas orthogonist does, or a NUCA chiropractor, you know, so that's kind of where I'm like, okay.
Well, even Rolfing. I mean, my first experience with fascia release really was when I got Rolfed. But, oh my God.
Okay, can you explain what Rolfing is for the average person who has no idea what that is? Because Rolfing to me sounds like, you know, somebody's throwing up.
Oh, okay. All right. So Rolfing is a body work that gets in and actually goes deeper than your traditional massage and releases or the fascia and its ability to restrict the body's movement. So what they do is your first appointment in, they take photographs of you. They don't tell you what the, you know, why or anything, but you're standing like this. And if you notice me, usually my right shoulder is a little bit lower than my left shoulder. But if I go through 10 Rolfing sessions, which restructures the fascia, retrains everything, then you come in for your 10th session and they say, hey, we just want to take pictures of you and see how you're doing. And you're standing there without realizing that your shoulders are even, but you're not working at it anymore. It's something that then you can keep a maintenance program on, or you end up going back to that slump where your shoulder goes back down. That was my first experience with fascia and trigger point release and things like that. So that is not exactly what you do, because you don't work on the whole body. You could, but I spend an hour on just from the waist down. And literally there are times where I walk into the studio and cannot pick my foot up to get up the curve. And when I walk out, I can do cross crawls with my hands to my knees. It's amazing. I've told Jesse several times, you should videotape me before and after, because it's pretty crazy what stretching can do. So as there's another, I know there's another one with a ball on the wall. It's a hard ball looking for
fascia release.
Yes, that they can do on themselves.
They can do that with the lacrosse ball. I know I've got clients that do, they're different size balls for different areas, but that is one that
it's a hard ball. We're not talking about a tennis ball where there's a little bit of give.
No,
this is a really hard ball.
Yeah, and do it on the wall. That's sometimes do it on the ground, but it keeps you from putting all your body weight on it. It just depends on how much, you know, pain they can tolerate. It is a very painful process. Like she said, it's not a massage. It is a it's painful to some people.
You moan some, but it is interesting. Like here, where one of my knots is, when that knot releases, you can feel this shoulder come down. So that's all connected, because this knot pulls my shoulder down, which in turn puts strain on the opposite side. So it's an interesting concept. Love for you guys to experience something like that. More important is that you continue stretching. Everything that we do in dentistry keeps us in this little wadded up position, and you don't want to end up being an old person walking around like this. So it's all about the stretching. And if you can't do it yourself, then you have to enlist the help of somebody like Jesse. Some of those, you buy those hard firm rolls called the roll. I sold mine because I can't use it. It hurts too much for me to use my entire body weight and roll on. Whereas if you've got somebody that can manipulate them, if it becomes too painful, you just hit them.
It's happened.
That's right. Anybody else have any questions? No? Okay. Well, then we'll go ahead and end our recording for tonight. And I hope to see you guys at tomorrow.